What are these superficial tendons right here? Those are the tendons of the flexor digitorum superficialis. And what are those for right there? The flexor digitorum profundus. So the eight of those tendons are passing through there, of the superficialis and the profundus, passing through the carpal tunnel. What's in the carpal tunnel? The superficialis and the profundus. 8 tendons, 2, 3, 4, and 5. Superficialis from the all-important medial epicondyle, profundus from the choroid. And they get mostly median. There is some ulnar picking up here in the hand, but I want to show you one more picture to give you ulnar. Okay. All right, I did that one. Woo! Oh, I'm going the wrong way. See, I just talked about that. What is that coming from? All right. Okay. Now, before I do the extensors, again, this picture is also not in your book. Okay, so I'm not going to beat you up with this either. I want you to see that your anatomy teacher is not doing his full job by teaching you all these muscles. Well, why is it when you prick your finger that you have so much blood there? Talk to me about the specifics of the ulnar nerve as they pass through the regions of the hand on the flexor side. As you can see here, median passing through here, and then here's ulnar. And my goodness, ulnar appears to be feeding most of the fingers. I thought you said ulnar was just for the pinky finger. All right, so I want to finish with this. There are actually muscles that sit between the digits of your fingers. And a minute ago, I showed you abduction for the thumb, extension for the thumb, and then I said there's an extensor pollicis longus and extensor pollicis brevis, and the radial artery is right between those two tendons. And you're going to remember those because if it has to go a long way, it goes to the ulna. If it has to go a short distance, it goes to the radius. So you'll remember those two extensors. No problem. That's the snuff box. Now, if you do this, right, the thumb is extending. I can explain that. What about these guys? Moving my fingers. These are called the lumbrical muscles, and I'm not going to make you learn their attachments, okay? They have very detailed attachments for the dorsal and palmar, and you can remember the palmar do abduction. These are the dab pad muscles, the dab pads. The dorsal interossei do adduction. The palmar interossei do abduction. They're the dab pad muscles. So they're not hard to remember in that sense. But what I wanted you to see, I'm not going to ask you that, I'm just showing you, is this. The muscles between the fingers that do abduction and adduction are all innervated by the ulnar nerve. Everything else we've done here for flexion has been, well, not everything, has been mostly median, right? And the median nerve passes through the carpal tunnel, okay? So what does the ulnar nerve do in the hand? That's the question here. And this is its major job. So this is a clinical manifestation of this. So you've gotten 3 clinical things today. The radial artery in the snuff box, what was the other one? The carpal tunnel contents, and the third one is testing the ulnar nerve. I want to see, now, is the ulnar nerve in the carpal tunnel? No. The ulnar nerve is not in the carpal tunnel. So you can very quickly figure out if it's a nerve problem in the tunnel or out. Where's this pain coming from? By doing this. So you take somebody's fingers and you hold them together like this. And if they cannot do either abduction or adduction, then that is an ulnar nerve problem. That's a different canal called Guyon's canal. You don't need to know that. It's a different place where the ulnar nerve is. So this is a clinical thing that I think is fun to know. You should take this home with you, right? I know it's in the snuff box, and I know what those 2 tendons are. I know it's in the carpal tunnel, and now I know how to test the function of the ulnar nerve. The ulnar nerve does abduction and adduction with the fingers. So if you can't do that, if you're having problems doing that, it's not a carpal tunnel problem. It's an ulnar nerve problem, a nerve outside that tunnel. Y'all don't look all excited about that. I thought that was really something that you would be excited about. Okay, we're moving on down now. The lumbar plexus, because I want to pick up the, oh wait, I didn't do the extensors. That would be important. It's important to do the extensors. All right, if I say extension, you think what nerve? Extension, you think what nerve? Radial, 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 right? Extension, extension, extension. Beautiful. Okay, so the radial nerve does extension. Now, here's a test question. What flexion is at the wrist to the medial epicondyle? Extension at the wrist is to the lateral epicondyle. There's your test question. So look, the extensor carpi radialis longus, lateral. Extensor carpi radialis brevis, lateral. Extensor digitorum, lateral. Extensor carpi ulnaris, lateral. Where does flexion happen from? Where does flexion happen from the elbow to the wrist, to the hands? Flexion happens from the medial epicondyle. Where does extension happen from? The lateral epicondyle. Yeah. So you'll remember that part. Again, I'm not going to ask you the base of metacarpal 2 and the base of metacarpal 3. I'm not going to ask you that. What else would I want you to know? The order, right? The order of these muscles. So the extensor carpi radialis longus. This is the most lateral. You see how I listed these? The extensor carpi ulnaris. That is the most medial. So the big 4 extensors, lateral to medial. Extensor carpi radialis longus. Extensor carpi radialis brevis. Extensor digitorum. Extensor carpi ulnaris. Lateral to medial. All of them come off the lateral epicondyle.
So we don't need to know the other ones that's labeled involved?
Nope. These are the ones you have to learn in your cat, and I wanted you to see their attachments in humans. You got to know these names, and once again, the metacarpal attachment, the pisiform and the hamate attachments. Now, I'm not trying to tell you not to learn. I don't want you to get that impression from me. But I'm trying to limit the amount of minutia that you have to memorize. And I'd like for you one day next year to walk by me and I say, extension in the wrist comes from where? And you say, the lateral epicondyle humerus. Yeah? And if I said radialis, longus or brevis, those got to be lateral muscles. If I say ulnaris, those got to be medial muscles. Okay, radial. Good. Now let's go down to the lumbar plexus. Now the reason I bring it up here, it's a little bit out of order in your notes there, I know. The reason I bring it up here is because I want to talk about the abdominal muscles. I'm not really talking about the muscles that are fed by the octrator or the femoral nerve yet. But I want you to look at the picture for just a moment. Okay, in the lab, the last lab period, most of you went through and found where the femoral nerve breaks off of the obturator nerve. Did y'all all do that? And I asked most of you, as you were doing the dissection, to follow the femoral nerve as it passes through a muscle. And I said that muscle is the iliopsoas muscle. And in lecture, I'm going to show you the muscle is actually 2 muscles. It's a psoas major, and that's the one you're cutting through, and the iliacus. So I want to teach you both of those today as we're going through this lumbar plexus. And so we're going to be looking in these psoas muscles for the fibers of the lumbar plexus, just like you did in the lab. But the reason I start with this today is because of this piece down here. You can see I've got it bolded here for you. These 2 nerves, the iliohypogastric and the ilioinguinal nerve, do in fact, these are the iliohypogastric, you can see here, coming off of the upper portion of the lumbar plexus, and the ilioinguinal coming off the upper portion of the lumbar plexus. Both provide motor information to the abdominal muscles. So, this is an important transition location. The iliohypogastric and the ilioinguinal nerves of the lumbar plexus are important transitional locations. So as we've been moving down the abdomen, which you have not done with me yet, I'm about to show you that, we have been saying that these muscles, the external oblique, the internal oblique, the transverse abdominis, the rectus abdominis, each one of those will have in your textbook listed the intercostal nerves. And they are not part of a plexus. But the lower portions of these abdominal muscles, which makes perfect sense, do get upper lumbar plexus information from the two nerves that I've just listed, the iliohypogastric and the ilioinguinal. So having introduced the lumbar plexus that way, let's look at the abdominal muscles. So here is the first one. Oh, yeah. So I'm going to come back to that. We got to feed. I'm going to do your regions on the leg. Okay, so here's the first one, the external oblique. Now, here's the way I've listed these. It is difficult to remember, in my opinion, all of the attachments of these. So, let's find some kind of mnemonic, some kind of repeat phrase, some kind of something that helps me remember it. 2, 3, 2, 3, 3, 3, 2, 3, 2, 3, 2, 3, 4. All these kind of things that I say in my head to try to remember these things. All right, so the way I've listed these is to list first the common attachments. All of them have some common attachments. So I listed them first. So the iliac crest, the pubic bone, and the linea alba. The iliac crest, the pubic bone, and the linea alba. The iliac crest, the pubic bone, and the linea alba. Are you following me? So these abdominal muscles share attachments on the iliac crest, the pubic bone, and the linea alba. Abdominal muscles attached to the iliac crest, the pubic bone, and the linea alba. All right, so then let's pick up the nuances so I can remember that. I've got that one for all of them. Okay? Now the external oblique also attaches to ribs 5 through 12. I don't know how to help you with that, except to say, watch this. This one attaches, the internal just undergoes from 10 to 12. And this one goes from 7 to 12. So as I'm working down, I go 5, 10, 7. 5, 10, 7. Superficial to deep. 5, 10, 7. 5, 10, 7. External, internal, transverse. 5, 10, 7. Iliac crest, linea alba, pubic bone. 5, 10, 7. Now I've pretty much got it. The attachments of all the abdominal muscles. I'm very close now. Okay, so back to the external oblique. We did that one. So can you do, you should be able to do all three. External, internal, transverse. Now you should be able to do them by saying iliac crest, pubic bone, linea alba, 5, 10, 7. I've got them. The attachments of the abdominals. Now there are a few nuances. So for example, the internal oblique also attaches to the inguinal ligament. Notice that that's not here on the external oblique. And this, as it turns out, is a very important place to point out to students. The inguinal ligament is a very important location to point out to students. So we're going to look at it a couple of times. It's shown here. This inguinal ligament is shown here. It extends from the anterior superior iliac spine over here to the pubic bone. From the anterior superior iliac spine over here to the pubic bone. So the first muscle that attaches here is a deep one. The external doesn't go there. It's superficial. But this one does attach to the inguinal ligament. And this is a very important anatomical landmark from the anterior superior iliac spine to the pubic bone. Now notice, there's a muscle right here, which you've seen in lab already. That muscle is called the sartorius. That one's coming. And there's a muscle that extends from the pubic bone across this way. That muscle attaches to the linea aspera, and you saw that one in lab already. That's that one. Anybody do this triangle with me in lab? I know at least 2 groups did. That is the adductor longus. And there's a little muscle right there on the floor Yours was way too big. That one's right on the floor of this. Do y'all see the triangle? Okay, so this is what I'm showing you. This inguinal ligament is going to come up again. The inguinal ligament attaches across here. And it's an important attachment here for the internal oblique. Now, the internal oblique, as you can see here, its fibers, iliac crest, pubic bone, linea alba, 10 to 12, right? 5, 10, 12. Superficial to deep, 5, 10, 12.
5, 10.
Don't correct me, I'm the teacher. That's a joke, because she's right, I am wrong. It's not 5, 10, 12, it's 5, 10, 7. 5, 10, 7, 5, 10, 7, 5, 10, 7. Superficial to deep. Now, this one is special right here, because the internal iliac muscle, as it extends inferiorly, has fibers that extend in males across the inguinal ligament into the scrotum. And in the scrotum, this muscle, this is a picture from later in your text, is called the cremaster. So there are skeletal muscle fibers from the internal oblique in the male scrotum. The extension of the internal oblique is the cremaster into the scrotum of the male. And then finally to the lumbar fascia. Now, let me show you a picture of that. I think I have a picture of it. Okay, so here's the inguinal ligament to show you its attachments, which I mentioned just a moment ago. And here's the thoracolumbar fascia, or the lumbar fascia. And you guys have seen this on your cat already. The internal oblique has attachment there. All right, here's the transverse abdominis, iliac crest, pubic bone, linea alba. 7, right? External, internal, transverse. 5, 10, 7. 7 to 12. Now this one also has an inguinal attachment and a lumbar fascia attachment. So really, the attachments of the transverse abdominis are only different from the internal in the fact that they are more extensive on the ribs. Yes? That's the big difference. And each one of these said they get intercostals, but you know something else, don't you? Do they get exclusively segmented intercostal nerves? What happens when you get low? Upper portion of the lumbar plexus, iliohypogastric and ilioinguinal nerves. All right. Now here's the last one, the rectus abdominis. People don't miss this one. This one is the all-famous muscle with these tendinous inscriptions. When people are very, very lean and they've been doing a lot of sit-ups, you can see these tendinous inscriptions forming what are called, people say this is the 2, 4, 6-pack of the abdomen, yes? And so this muscle goes from the pubic bone and crest, no problem, up to the xiphoid process. The only piece that the students miss, are the attachments to the ribs. So these muscles extend all the way up to ribs 5, 6, and 7, and you can see the attachment to the xiphoid here down to the pubic bone. This is the last. 4 abdominal muscles, external, internal, transverse, rectus. Can you do the attachments? Okay, so that was my big emphasis here in the abdominal area to teach you their attachments. And I try to do it by simplifying it. Linea alba. Okay, not to do that again. All right, so as we move down, we want to find the lumbar plexus, and I've been promising you this. You're going to find it in this muscle, the psoas muscle. And the psoas muscle is known collectively as the iliopsoas and exists as 2 pieces. It exists as the psoas major. That is the muscle that you trace the femoral nerve through in the lab. So when you were tracing that femoral nerve down to find its division, the obturator coming off of it, you went right through this muscle, the psoas major. And then its deeper counterpart is the iliacus. So let's do each of them. Here's the psoas major. This one attaches to the bodies and the transverse processes of the lumbar bones and to the lesser trochanter. Bodies and transverse processes of the lumbar bones and to the lesser trochanter. And it's going to pick up lumbar plexus. I will not ask you L1, 2, and 3 here. You're getting lumbar plexus now. I got iliohypogastric and ilioinguinal to go to the lower abdomen. I'm moving into the lumbar plexus. If I want to find it, I have to go down through the psoas major muscle, which is attached to the bodies and transverse processes of the lumbar bones and the lesser trochanter. Now, where is the lesser trochanter on the femur? On the front or the back? It's on the back. It's on the posterior side. So this is the posterior view here. There's the lesser trochanter. Is it medial or lateral? It's medial. Okay, so there's your attachment for the psoas major. Now the iliacus attaches in the ilium, hence its name, iliacus. And it's fused together with the psoas major to attach to the lesser trochanter. Now, if we were up in the arms, and even in the legs, through the bicep femoris this way, we would normally just call this one muscle. And so it doesn't hurt us to know that textbooks refer to this muscle as the iliopsoas. They have the same distal attachment. You could consider it one muscle. One of them comes off of the lumbar bones, and the other one comes off the ilium. But they both go into the lesser trochanter. All right, now, the emphasis on the femoral, I'm going to start now. The next muscle, which is the floor of the femoral triangle that you guys are finding in the lab, is the pectineus. And the pectineus, as you see here, passes from the pubic bone. Okay, I just did something. Did y'all see that? Simplify as you think. Simplify as you think. I'm going to take this in the lab, y'all. Unless it's necessary, you can say things like this. It's attached to the pubic bone. That's okay. I don't expect you to say pectineal line. You had to learn those things for the bone stuff. But now you got to learn where the muscles attach. So I put a tape on the pubic bone. There's some stuff you can put there already, right? I put a piece of tape on the pubic bone. You can say, oh, I know, some stuff that goes there. I've seen the inguinal ligament there already. I've seen the rectus abdominis there already. Okay. Now this one also attaches to the lesser trochanter, so I'm guessing that's a test question. The iliacus, the psoas major, and the pectineus all go here to the lesser trochanter. And they are all involved in some way, they're involved in adduction. They cross in an angular fashion to the back of the femur. The pectineus is what we consider really the first major adductor as it pulls the femur toward the body. And it's innervated by the femoral nerve. Okay, so watch the presentation as it moves from these nerves. I'm going to bop around on these nerves from femoral to obturator, femoral to obturator, femoral to obturator, femoral to obturator. Why am I doing femoral and obturator? Two reasons. One, these are the nerves you had to find in the laboratory. And the muscles that they go to, I need to teach you because you're also finding these muscles. So in the laboratory, I asked you to find these two nerves and the muscles they supply. So now I'm showing them to you. The pectineal line of the pubis, the lesser trochanter gets femoral, the pectineus. It's the floor of the femoral triangle. Now the next two muscles are the adductor longus and magnus. Now, your cat calls this one. Does anybody know? The adductor femoris, yes? Your cat calls it the adductor femoris. You do have an adductor longus, a pectineus adductor longus. You don't have an adductor magnus. The cat does have a gracilis on it. It's a little flat, thin muscle sitting superficial. So these three I want to show you now for the adductors. Here's the gracilis, and this one from the pubic bone to the medial tibia, inferior to the medial condyle. So the gracilis is the most medial muscle. It's not a powerful muscle, but it does do adduction, and it gets obturator, femoral obturator, femoral obturator. Okay, I'm moving down. Iliacus gets femoral. Pectineus gets femoral. Now the major adductors, the gracilis, the adductor longus, the adductor brevis, those muscles are all going to get obturator. So it's the gracilis here, is a major adductor. The adductor longus, part of the femoral triangle, also from the pubic bone. Now we're going to put adductors on the linea aspera. This will be a test question. What can you do with muscles attached to the linea aspera? Now, where is the linea aspera on the femur? Where is the linea aspera on the femur? It's posterior. So here's your posterior surface here. There's the gluteal tubercle for the gluteus maximus, and here's the lesser trochanter, and there's the linea aspera right there. It's a long line on the back of the femur. It will be a lab test question. It will be a lecture test question. Okay, so I'm going to say it now, and I'm going to show it to you. The adductors that get obturator attached to the linea aspera. The adductor brevis, the adductor longus, the adductor magnus. They go to the linea aspera. Adduction comes from the linea aspera to the pubic bone. Okay, so there's some nuances there we'll want to see, but that's a big point. Here's the second piece here. On the front of your leg, I will teach you 4 major muscles that we will call the quadriceps. And the one on the medial side and the one on the lateral side, the vastus medialis and the vastus lateralis, both attach here. And they do extension at the knee. So this is a critical location on this bone for the movement of the lower leg. So if I'm going to move the leg this way, I'm going to adduct the leg. I do that primarily by attachment to the linea aspera. If I'm going to do this with my leg, extend, I will also do that by way of attachment to the linea aspera. Now that seems backwards, doesn't it? Doesn't that seem backwards? It's on the back. How am I attaching to the back of my leg and extending? It's because those muscles do this. They come this way across to attach here. The medialis and lateralis here. So it's a really important spot for the linea aspera. Okay, so the adductor longus attaches to the linea aspera. It gets obturator. Now, here's another phenomenon here. Adduction at the leg is an obturator function. Adduction at the leg is an obturator function. Extension at the knee is a femoral function. So I'm talking about the linea aspera, right? This is obturator. This is femoral. So when you see them in the lab now, you think those. Obturator for adduction, femoral for extension. That's their primary functions. All right, finish the adductors and then shut up. The adductor brevis attaches also to the pubic bone of the linea aspera. What do you think the difference is between the longus and the brevis? Longus and the brevis. I did it with the thumb, right? The extensor pollicis longus, the extensor pollicis brevis. What does it mean to say long and brev? Okay, one of them goes further than the other one, right? One of them goes further than the other one. Exactly. So there's the brevis on the linea aspera, and there's the longus. So this one is longer than that one, the longus and the brevis. And then the magnus has attachments that I want to spend a little time talking about. So I will start with the magnus on Wednesday. We're getting close. We're getting really close. Now here's what I can do. I can finish on Wednesday. And then lecture test on Monday. Because the test is scheduled for Friday, but it's fall break, and I can't do that. They won't